So welcome, everyone. I'm Marie Abraham. I'm the Vice President for Programming and Publications at the Institute for Patient and Family-Centered Care. And today we are joined by two individuals from Moffitt Cancer Center, Ann Biddleman, who's the manager of the Patient and Family Advisory Program. And then we also have Judy Atkins, who is a patient advisor within the Patient and Family Advisory Program. Providing expert technical support today is Matt Da Silva. So if you have any issues, you can certainly direct chat to him. And Sherry Hayek is joining us today as well, and she is moderating the chat today. So today's discussion is establishing and expanding your Patient and Family Resource Center. And we're so excited to see how many of you signed up and registered. It's obviously a topic of great interest to you. So as Sherry put in the chat, we feel free to chat in your name, your organization, and where you're located. We are recording this conversation so that we can share with those people who registered for the recording, and we'll be posting it on our website. While we love seeing faces, especially me, I love seeing people's faces. If you prefer, you can go off camera. Next slide. So we definitely want to acknowledge our PFCC Connect sponsors. So thank you to Emory Healthcare, Providence Healthcare, and University Health for your continued support of PFCC Connect. Next. So let's just touch on these group agreements. As you know, these conversations are really intended to be interactive and informative. So we'll share a few slides, and Ann and Judy will go over that presentation just to set the context and provide information to get the conversation started, but then we'll dive into the discussion. So we just want to remind everyone of our group agreements. Be present as possible. When we move into discussion, it would be great if you can go on camera. Participate actively. So we encourage you to be curious, ask questions, but also share your experiences, perspectives, and any challenges you may have faced. You can either chat in your questions or ideas, or you can raise your hand and we'll call on you. Let's share space. Allow others to contribute to the conversation. Embrace a learning and growth mindset. All of you bring expertise that we really are appreciative of, and we can learn from each other. And finally, we hope you enjoy the discussion and have a good time. As I said, if you experience any technical issues, you can chat directly to Matt Da Silva. Next slide. Thank you to all of you who shared questions and comments when you registered. Here are some of the issues. These aren't all of the issues that were put in the registration form, but here are some of the issues that we heard about what you're most interested in. So who staffs the resource center? Is it staff members? Is it volunteers? Is it paid patient and family advisors? What are some of the best practices for staffing your resource center? How can you obtain funding to support the resource center? Do you need leadership support? How do you get that? How is space allocated to allow for the resource center? And I know that's an issue for like some of you who might be in a small hospital or a rural hospital. How are the resources that are shared with patients and families maintained and kept up to date? Has anyone established a virtual resource center? And I think that Moffitt is in process for doing that, so we'll hear from them. And what if we're a rural or smaller health healthcare system. What can we do to establish or maintain a patient and family resource center? Next. Okay, I am going to hand it over to Anne and Judy. And as you can see, we did have a third person who was supposed to be on today, but unfortunately, Anne will say something about that. Okay, Anne.
Thank you so much, Marie. We are so thankful that you reached out to us to share about hospital resource centers. I started my career at Moffitt in our resource center, and I still support it today. So it's a topic that's near and dear to my heart. And I'm looking forward to us all having the opportunity to learn from each other today during our time. And we have left plenty of time after this short presentation for discussion. I'm Anne Beidelman, manager of Moffitt's Patient Family Advisory Program. I'm co-presenting with our very generous and compassionate advisor, Judy Adkins, who partners with our wonderful library team. Our wonderful library team is supported primarily by Jackie Beauchamp, who is the supervisor of the patient library. And unfortunately, she woke up not feeling well today, and we're so sorry she can't join us because she is really the backbone behind this team. And I hope that she's feeling better very soon. Next slide. So before we dive into our patient library, I would just like to share a little bit about Moffitt. H. Lee Moffitt Cancer Center and Research Institute was established in Tampa, Florida in 1981. So we're a relatively young cancer center. We're Florida's only NCI designated comprehensive cancer center based in the state of Florida. And annually we serve over 97,000 patients from over 130 countries. And currently 92.4% of our surveyed patients give us the top box rating in the likelihood to recommend question, giving us our highest patient satisfaction scores in Moffitt's history. Next slide, please. So I think a contributing factor to that success is Moffitt's strong culture of patient and family-centered care. It was our foundation when we started. Our founder, H. Lee Moffitt, was a cancer survivor and lost several friends to cancer. So we started with open visitation and private rooms, et cetera. But in 2005, we took a more formal approach to patient and family-centered care and started our PFAC. We also integrated advisors into many different committees and work groups to bring the patient and family voice into the planning of new initiatives, and then expanded the program to include peer-to-peer support. Next slide. It was actually during one of those first initial PFAC meetings 20 years ago that we heard from patient and family advisors. They recommended that we create a patient library. This idea fit into our culture of patient and family-centered care, and as sharing information and treating a patient as a whole person is first and foremost. So it was very supported by our leadership, and they dedicated the funds and space necessary to make that happen. And we started with one patient and family center that we call the Patient Library and Welcome Center. Next slide. So we have a few different library locations now. At our largest campus, we have the Patient Library and Welcome Center, which is pictured here. And this campus has both inpatient rooms and outpatient clinics. And our library serves as a comfortable, non-clinical space for patients and caregivers to come and relax and spend time. And when you're in the hospital, it can be really nice to have a space that doesn't feel, like a hospital. Next slide. At our McKinley outpatient campus, we also have a patient and family center. At this location, we share the space with our arts and medicine department. So in addition to our standard library services, patients can also visit the center to paint, draw, do origami, or any other expressive art practice that's offered at Moffitt. Next slide. At our newest surgical hospital that opened last year, we have a patient resource center that's located on the second floor, and it's right near our surgical waiting area. Next slide. So each of our libraries is staffed by a full-time patient and family specialist. And in addition to offering a welcoming environment for patients to relax, we also offer educational resources. We have booklets on cancer types, treatment, coping, caregiving, nutrition, survivorship, and more. And we make sure that information we share is reputable, easy to understand, and we offer information in English and Spanish. And not only do we have resources so patients can better understand their illness and treatment, but we also are trained to be active listeners. So patients and caregivers might come in to visit the center for a complimentary snack, but as we talk with them, they will hear that they might start to share some of their struggles or concerns. And then we have the opportunity to share about Moffitt resources with patients and caregivers, things like social work, integrative medicine, and more. And we hope that we're planting the seed so that when and if they're ready to reach out, they'll know how to get connected to those helpful resources. We also have patient advisors who peer visit in the patient library on select days to make that peer-to-peer connection with library visitors. Next slide. So we recognize that not all patients have access to a computer or have the technological skills to use computers. So we often assist patients with creating and using a patient portal, as well as other basic technical support. Guests of the library can use our computers to browse the internet, check emails, and print, and we also offer free fax and copy services as well. But our primary role is to meet the needs of the patient and their families who visit our patient library locations. But when our team isn't actively assisting patients, we also work on additional programming. And to tell you a little bit about that, I would like to introduce you to Patient and Family Advisory Program Patient Advisor Judy Atkins. Judy peer visits in the library 2 days a week, making amazing connections with our patients and caregivers. Judy also presents patient and family orientation sessions in person. Judy, would you like to tell us more about patient and family orientation?
I'll be glad to. I also want to mention that I'm a former patient. So when I introduce myself as a volunteer, I also include that I'm a former patient, which seems to help people be able to talk to me about whatever's going on in their life, since I've been through much of what they're going through. If we could have the next slide, please. I did first want to thank Anne for the staff in the library at Moffitt. The people who work there are just the best example of the way to treat people who do the library for assistance. And they really set a fine example for volunteers. I think that that's one of the reasons that our library has succeeded so well, is that people get treated like people and not just a disease there. The staff is just wonderful. So it's really important, the staff, if you get staff, it's really important that they be trained in active listening. Our orientation for patient and family, and it should say friends too, because we include everybody as part of their family. Everybody they consider family, we consider their family. It takes about 30 minutes in the typical session, although depending on how much we talk and chat and how many questions they have, it can take a little longer. It's open not just to patients and family, but anybody who wants to attend and get more information about Moffitt, whether they are going to be a patient or not. Including all of you are invited. The phone number is down there where you can make a reservation to attend an orientation. We offer in-person and virtual sessions using Zoom for the virtual sessions, as well as English and Spanish language sessions. I do the in-person session, so that's what I'm going to address more than anything else, although we use the same slideshow, so the information is the same. So when somebody comes in and they say they have an appointment for orientation, I introduce myself. We have snacks and drinks. So we start, I offer them that before we start. And then I do a little small talk just to try to help them relax while we get settled into getting the TV going. As you can see here, there's a TV that we do the slideshow on, and just kind of help break the ice. My goal is to help them relax so they can focus on what's being said during the presentation. Some of our people come from distant places in Florida and can drive for 2 or 3 hours before they get there. So they need a little relaxation before they settle into watching the presentation. I also, during that time, encourage them to ask questions and to ask for clarification of anything that I'm saying that they don't understand. And this is important that because we also encourage them to ask their doctors questions about anything they don't understand. So I try to set that example early on that it's okay to ask questions. The session begins with a brief history of the hospital. Then we discuss how to physically navigate the hospital because it is big and very confusing. We talk about the various landmarks that we have around so they can know where they're going, and that they're on the right path to get to where they need to go. Then the third section is going over the array of support services that we have available to the patient and the caregiver, which is usually a family member, but not always, and that they can include all of their family in any part of this. And our goal is to help patients lessen their fear and soothe their anxiety. Having a cancer diagnosis is stressful enough without having to worry about being late for an appointment because you get lost on the way. No one should have to worry about whether they can get the support they need through this process. It reminds me that I was just talking to a man who was new to our hospital, who had been at another hospital, and he had to go to all these different hospitals to get different work done, and the doctors weren't communicating clearly. And he really wanted to know that was he going to have to go to another hospital to get an exam done. And I was able to tell him, no, everything is done in our hospital. And that really was a welcome relief to him, that he did not have to travel all around town just to get something done, that we did it all right there. So our premise in all of this is that the patient needs to feel prepared and empowered to understand their options. To contribute to this process, not only do we offer guidance, we help this process by giving them a message bag, which includes all the information they got in the orientation, as well as some file folders to help them organize their information, and keep it all together in one place so they can feel like they're in control of something. So that's how we do orientation. And Anne, I'll give it back to you.
Okay, thank you so much, Judy. We can't thank you enough for not only joining this presentation, but helping us in the library and delivering the orientation. I think it really adds a lot of value hearing this information from a patient who, has been there. And it's really beneficial to hear it from an advisor.
I have to say that when I was a patient and went through orientation, it was a big help to me, and especially the bag, because I lose everything as soon as I get it. So I had one place to put it and I didn't have to worry about it. So that was quite helpful. Thank you very much.
Yeah, absolutely. And we get input from our advisors on what should be included in the orientation. And then our advisors deliver the virtual orientation 3 or 4 days a week, and then Judy delivers it in person once a week. This is a wonderful program. Here's the problem. And I bet every person is already asking the question, how do you get people to attend? And that has been something we have struggled with for a decade. And we have tried all different approaches. Zoom has really helped tremendously. Being able to join from home has been a huge benefit. But even with it with Zoom, still people, you had to make them aware of it. So we've tried all different things, but one thing that has made the biggest difference, and it probably took us a good year to get it to accomplish this, was that every new patient now receives an email after their first appointment about encouraging them to attend orientation. And that has been a game changer in terms of getting people to attend. And it will never be mandatory. This is always, it's only if and when you're ready to attend. We think earlier the better, just so you know all the different support services that are there to help you. But many patients, they are much more focused on talking to their doctor and getting their diagnosis or treatment plan developed before they have any capacity to think about anything else. And we totally understand that. But it is a great program, and I think that partnering with our advisors to deliver it and give input on the content has really made the difference. Okay, so next slide. I want to talk about another program that we offer through the Patient Library and Welcome Center. Our patient and family specialists, when they're not helping patients or caregivers, are also working on creating, delivering, and facilitating our Meet the Expert sessions. And these are 30-minute educational sessions through Zoom, and they're presented twice a week by Moffitt experts. And we offer sessions on Tuesdays and Wednesdays at 10 a.m. And we have new topics every week, such as nutrition, stress management, caregiver tips, clinical trials, treatment side effects, and many, many more. And all are welcome to attend, including patients, caregivers, team members. Really, they're open to the general public as well. And to view upcoming sessions, you just visit moffitt.org/meettheexperts and feel free to sign up if you'd like. We also have recorded our most popular sessions so that they can be viewed at convenient times. Next slide. So this is really exciting. We have a new podcast that we just developed, and Jackie Beauchamp was leading the development of this. It's a podcast called In It Together. And it's a podcast about caregiving. And to create it, we collaborated with family advisors and social work. And it was really developed to normalize the caregiving experience by sharing caregiver stories and encouraging caregivers to seek mental health support. And we worked with our family advisors right from the beginning, and they helped us in brainstorming the idea, in story development, and they even helped with the editing. And it was their suggestion from the start that we create a podcast. Jackie and I were thinking of a caregiver class, and they said, a class? That just sounds like more I have to do. I don't have time. But if I could listen to something in the car, that would be great. And so I think there's just so much value in partnering with patient and family advisors right from the start, rather than learning the lesson the hard way. If we hadn't listened to that, we had created a class, nobody would have come, and we'd spent 10 years trying to figure out how. So it's wonderful to have their involvement and partnership. You can listen to, the first series has dropped. There are 5 episodes. They are, I think, fantastic. I have to thank Jackie for that. And they're available on all major podcast platforms. Next slide. Lastly, we are responsible for the development and editing of and distribution of the Partners newsletter. The Partners is the quarterly newsletter for the Patient and Family Advisory Program. And this publication features patient stories, caregiver stories, information about support services at Moffitt, and then upcoming events and news at Moffitt that would be helpful for patients and families. It's published in English and Spanish. It's distributed in hard copy at all campuses, and we have an e-newsletter that it goes out to all new patients and in English and Spanish. This last edition went to over 8,000 new patients with an open rate of 49% and to over 300 Spanish-speaking new patients with an open rate of 53%. So as we conclude, next slide, I just would like to mention that through the library program, patient and family advisors are involved at every level. They give input on orientation, meet the experts. They even present sessions. They're involved in it together and partners. And this really helps ensure that we stay patient and family centered and include the voice of the patient and caregiver to the very best of our ability so that we can best serve our patients and caregivers. And lastly, I would just like to thank my library team for their passion, compassion, and excellence, as Judy mentioned earlier. Just top notch in their role, and we can't thank them enough. We've learned a lot of hard lessons along the way, and I'm happy to answer any questions that you have. I know Judy is happy to answer any questions that you have too. And hopefully we can learn from each other in this next half hour.
Thank you so much, Anne and Judy. That was terrific. And we have a nice, very interactive chat going on here. So let me just, well, if you want to ask the question that you posted in chat, please raise your hand and we'll call on you. But let's just get started with a few of the questions that came in through chat. So Anne and Judy, do you have good attendance at your orientation? And I know you spoke about it a little bit, but do you have good attendance?
We do. We have what we consider good attendance since we added that email. It's not uncommon to have up to 13 people attend each session. In person, we limit the number. You saw kind of in the picture that the space is kind of limited. So we limit it to 4 or 5 people, I believe, to be able to attend at a time. But we feel we always would like to see more people attend, but to have that steady volume, we're real happy with that.
Okay, so here's another question coming in. How do you get or work out the funding for this important program? So how do you address pushback, concerns about funding taking away money for direct care?
Well, I've been at Moffitt 15 years, and thankfully, we have not run into having to cut back on team members. It's actually grown. We've sometimes I think when you see all that we do outside of helping patients and caregivers directly and all the additional value add we're offering through programming like orientation and Meet the Experts and In It Together and Partners newsletter, you can see really, I think leadership can see the value that we're adding and it aligns with our culture. So we've been fortunate that we haven't had to cut back and fortunate that they funded the library to begin with. So the space has been the area that's been a little problematic for us. So we have kept that library space at our main location that's in my background. But I can say, after working here this long, I can count at least 3 times that providers or departments have come after it. And we've kept our fingers crossed and we've not known how it was going to go and we kept it. Sometimes they never wanted to necessarily eliminate us, but move us to maybe a less desirable space. So they do value what we're doing and they see it as central to a mission of patient and family-centered care. At our McKinley campus recently, that's the center where we have the combination of the arts and medicine and the library. We did recently were asked to move. They took our space and used it for clinical care, which understandably they want to expand, they need the space, I get it. We were fortunate that they moved us to a smaller place on the 2nd floor and our team made it work. And it actually is busier now than it was before. The location is a little better, more centrally located, but also the team was so innovative. It kind of connects to a lobby. So they kind of spilled out into the lobby area and created this transformed this lobby area into kind of an extension of the patient and family center. And it looks more beautiful. It looks more inviting. There's resources outside and in addition to inside. And they made it work. So what we thought initially was a negative, the team turned into a positive. So I think that type of thinking is really important to, because we're never going to be generating revenue, none of us, let's face it. So we have to be creative and see what can we do to make it work. And I'm so proud that they're seeing more patients now than they did before.
Thanks. I see a hand up. I don't want to mispronounce your name. Is it Jadzia Adrian?
That's correct. So
Okay.
I did ask a question in the chat, but it probably got missed. The chat is moving very, very quickly. It's very difficult for me to follow. I am totally blind, so I'm coming at this from a different perspective. My question to you guys is, being so well established and doing all the work that you do, which is phenomenal, what would you say would be your biggest lesson? And what advice would you give to a patient and family group who is attempting to start a grassroots uh, patient and family resource center at their campus?
Great question. Thank you. Anne,
I
Judy?
think, Judy, I'll go first if you want to go second. I'd love to hear your thoughts too. I think, to me, the most important thing is partnering with patients and caregivers and listening to what your patients and caregivers want and need. Because it might not be exactly what you think. Depending on your location, where you're located and how far your patients are from you, they might be asking for a virtual library. That might be their first thing they want. And being open to the fact that you want to share information and resources, that you want to help empower patients and caregivers and share information and resources. We'll partner with patients and caregivers and find out what that looks like to them, and then go in that direction. And because you can do that a lot less expensively. Our Meet the Experts program didn't serve very many people at all until it went virtual. So, you can do a lot without space if you can't get the space. So I guess my best lessons learned are listen to what the patients and caregivers are telling you they want. And then their voices are, at least at Moffitt, are so valued. If you can say, this is why we think we should do it. And this is what the patients and caregivers are asking for and how it would benefit them. And if we're really wanting to treat the whole person, these types of programs are important. And then I think you need a leader who will advocate for you. And fortunately, we have had that. But if you find that one senior leader executive, that maybe it's the CNO, or maybe it's the director of social work. At Moffitt, originally, it was the director of social work that really advocated for this, along with who served on the council. So that you just need that one leader that can be influential as well. Judy, do you have anything you want to add to that?
Well, I agree with what you said. I do think starting out, having an area where people can come and talk to you. I'm very into computers, so I don't have a fear of them because I worked as a programmer for most of my life. But a lot of people are scared of computers, and doing things virtually helps, but you're going to need someplace, probably, it doesn't have to be a big place, just a small area where people can come and sit and talk to someone and find out about these things, and maybe have a computer there that you can help them work with. But obviously you need to know what your patients and family members want before you can move ahead, because you can, you think you know what somebody wants, but your area may be completely different than ours. And our ideas won't work in your area. But if you sit down and talk to the patients about what they want, and former patients especially, as a patient, I was afraid, honestly, to say much about what I wanted because I didn't know how that was going to affect things. But as a former patient, I have no qualms about speaking out.
That's great. And I want to see if there's two people who talked about having virtual online resource centers. One is Catherine Smart. I don't know if you want to come on and talk about your ebook library and public website. And then there's also from Michigan Medicine, Bethany Lee Laner. So either one of you want to come on and talk about?
Sure.
Yeah.
Sure. Hi, Kathy Smart here from Advocate Children's Hospital in the Chicagoland area. I manage 2 resource centers 30 miles apart. Our system has grown to so many hospitals across states that pretty early on we realized we needed to not only have two small library resource centers, but online presence. So we have a wonderful, robust web team that created a web page for our children's health resource centers on their website. And then I was fortunate enough to be able to get a library catalog that would allow us to have ebooks, allow us to actually install documents on our library system. And anybody in the public can borrow ebooks. Its registration is free. You do need to register, but we don't take all information. We have try and at least protect street address. And of course, this is all secure. And anyone, you don't even have to have a doctorate advocate, can use our ebook library. And we've grown to over 1,000 ebooks online. We're a children's hospital, so it's primarily parenting information, medical conditions and disabilities related to kids, as well as health wellness. And we try and have information for parents, kids, and teens. We also contracted with kidshealth.org. Some of you may be familiar with that website, which is great. And we license to stream their information into our website, and they have thousands and thousands of handouts in English and Spanish. And for those who can't read or have trouble seeing, you can actually, they're spoken as well, so you can listen to the articles.
Great, thank you.
You're welcome.
Bethany, did you want to add anything?
Yes, thank you so much. Good afternoon to everyone. I just wanted to share that we have a team under our Office of Patient Experience, and that group is responsible for what we call the Care Guide site. And we probably have over 8,000 different materials. Some are Michigan Medicine authored materials, so homegrown. You know, if you're having cardiac surgery, you're going to get a binder with information, and that's also lives on this live site. But we also have American Heart Association and many other reputable organizations with their materials on there. We have videos that we've created with our teams that live on that site. And it's a beautiful tool because it can be accessed around the world. In Germany that have done that. So it's a true resource for sure. And then within our library, we have information guides that our librarian creates that live on those sites as well. And that's for that deep dive, for the person that really wants to learn a lot more. So we try to have a on-site presence. We try to make sure our clinical teams are aware of this. But then, you're going to have folks that filter into our library, and we can help them with things that we have physically present, but then, offering that out. And we're excited because we have a new inpatient tower coming, and we're going to try a little kiosk mode where they can, it's always going to be about the relationships, but perhaps just letting them try a little bit of that learning with us present so that they can understand it when they go home. So it will be interesting. And we're also very fortunate to have philanthropic dollars for a real library with books. Much like many of you, our patients come from all around the state of Michigan, our Upper Peninsula, Ohio. And so we want them to still take books out. So we actually have prepaid mailers that we give them. And if they are living far enough away, we send that with them, and then we cover the cost of that book return. And it really, increases they're not interested until you tell them that you're going to give them the prepaid mailer. And then all of a sudden, they're checking the books out. So that would be something that I would encourage you, if you're considering books.
Great, thank you. James, did you want to kind of jump in here?
Yeah, I'm sorry. My name is James Adeyelu. I'm in Colorado, so I work for Prowess Medical Center. That's in Lamar, Colorado. So I'm sorry I've been missing this meeting for a long time because we were so busy at my place of work. So I'm the co-chair of our PFAC, the committee. So, and then I just want to continue to learn because I really enjoy, this our meeting because I gain a lot because my facility is in a rural area. So we are not all that, exposed to what is available in the series. So by joining, then, I learn a lot and I take it back to my senior management, and we are able to implement some policies that are patient-centered care, and then we really appreciate that.
Well, great. Thank you.
Thanks.
So one of the questions, it's actually come up a few times, is how do you choose which materials to include in your library?
Well,
Yeah, oh, sorry. Oh,
no,
go
go
ahead.
ahead, James. Go ahead.
Oh, I'm sorry. So, we we have some teenagers or peds, pediatric patients that we attend to. So most times, we put this human anatomy, like the graphic ones, so that we try to encourage them so that they might show interest in medical field. So those are the things we do in our facility.
Great. Anne?
Well, in addition to ACS and LLS and, American Brain Cancer Association and, kind of cancer support community, all the reputable, resources out there, like for books and things, like we want to have a variety of books available for checkout. And so we will reach out to like our yoga therapist or an integrative medicine specialist manager and say, what books do you think would be important for us to hold in the library? And we make sure that those are vetted. And sometimes people will make recommendations or say, I think you should carry this book. And we don't really have, our backgrounds aren't clinical. We aren't licensed clinical oncology social workers. So we make sure every book is vetted by the appropriate expert at Moffitt. And it might be the manager of social work, if it's a book related around coping, or it might be someone from our patient education department. But anything that comes our way that we think, oh, I think patients would really like this. This would be interesting. We don't make that call. We always have the expert at Moffitt make that decision so that we can, make sure that it's a reputable resource for our patients and caregivers.
Mm-hmm. Great. So I know we've also had questions about compensation for the volunteers. And I know that for you at Moffitt, you have a paid patient, what do you call it, specialist?
Yes, we have paid patient and family specialists, one at each center, 2 at our busier center. And then we also have volunteers that are unpaid and that are helping out. And our patient advisors that help out, they're also unpaid as well. Moffitt doesn't pay patient family advisors. That was something that our Patient and Family Advisory Council made a decision on and voted on in the early days, and that hasn't changed as of yet.
Okay, and we have a chat from Melissa. Melissa, I don't know if you want to jump on and say a little bit about your chat or.
Sure, I can. So I'm Melissa Baker. I'm the Family Resource Center Coordinator at Akron Children's Hospital in Akron, Ohio. I have worked here for 16 years as a child life specialist in our pediatric intensive care unit before transferring to this role. We opened a year, not even a year ago, it'll be a year in April that we opened. So our center is a little different in the fact that, yes, we have library services. They were in our center until about October, November, and then they went virtual for the library services for our families. So we offer a lot of community agencies in our center, along with in-house services for our families and programming. So yes, we have computers families can use, and we have a business center they can work at if they're here working virtually, inpatient, or have long appointments. But we bring in Jobs and Family Services, we bring in United Way, and we run a WIC clinic once a week. And we also have our care coordination team here with us every day of the week. So if families stop in and they need help with transportation, paying utilities, housing referrals, help with setting up, scheduling appointments, or paying for insurance or their medication at the pharmacy, things like that, any of those social determinants, then they see the care coordinators. Or if they're coming in signing up for Medicaid benefits or SNAP benefits or anything like that, they see the Jobs and Family Service caseworker. So we do all of that, plus obviously the library virtual part. And they can even sign up if they want to speak with an HR recruiter through our hospital. So there's like a lot of different resources we offer here. And then we do a lot of programming. I run programming for the hospital. Like last year, we weren't even open a full year. We ran 40 programs with over 1,900 participants, outpatient and inpatient down here, like crafts, bingo, meet and greet with the doggy brigade, our dog team, things like that. So, and we have like snacks, coffee, tea and whatever for patients and families and their guests. So that's kind of how our center runs. And then we do have like free children's books so families can build their library. We have a wonderful donor for that. So we have 2 full-time staff down here, myself and then a guest attendant. And we have volunteers then that help support us.
Great.
So just wanted to
Thank
kind of
you.
share that since that was a little bit
Yeah.
different than what we were talking about.
Sounds amazing.
Yeah, it does.
So if
It's a
anyone,
lot. 40
yeah.
programs, that's a lot.
And I set my goal at 6 because we were new, and then it just kind of like, well, let's do bingo every month and let's do this every month. So we just kind of kept that going.
That's terrific. So, okay, we just got a chat about, hold on, let me go. So what are different sites doing to increase the participation in classes that are both virtual and in person? Does anybody want to talk about that? Raise your hand if you want to, or Anne, do you want to say anything about it?
I can start us out. We have a strong presence on Moffitt.org. We have digital signs. We have schedule flyers for each of the different programming. We have a beautiful calendar for Meet the Experts each month that goes out with the different sessions that will be held. We advertise all of these support services, and including orientation and Meet the Experts, in our partners newsletter that goes out. Word of mouth. So one of the roles of our patient and family advisors when they're in their peer visiting role is to actively listen, and they might hear someone who could benefit from this type of programming, and they're trained to share information about it. So part of their role, in addition to supporting through active listening, is to share resources. And so that word of mouth coming from an actual former patient or former caregiver is, really impactful. It means a lot more coming from them than it does from any digital sign. But those are a few of the ways that we promote both the in-person and the virtual programming at Moffitt.
Yeah. Great. Oh, okay. Anne, this is a question for you. You mentioned emails was a game changer. How did you make that happen?
Oh,
Or
God.
Judy, you could talk to. I don't know.
This was hard. I mean, this took years. So we use Parisha for our online registration. And there was kind of an effort, there was a philosophy at Moffitt of don't overwhelm patients. I appreciate that. I think that's a great philosophy. Don't give them all the information they ever wanted to need, you know, keep it simple. So that getting past that philosophy was the hard part, because this is an added thing we're asking you to do. And I can tell you, it all changed with one IT guy. One IT guy got it, and he advocated for us. And, you know, our director was advocating for us, but nobody just, you know, it wasn't anyone else's priority. And this one IT guy, he got it, and he came and he listened to the orientation. He brought his team and they participated in the orientation session. And he then advocated on our behalf and fought and fought and fought. We got yes, we got no. It took at least a year, if not more,
Mhm.
for it to happen. And finally it did. And that's, you know, that's all we want, is we want people to decide for themselves if they want to attend, but we want them to know. You know, we want them to know about it and be aware, because I used to deliver it in person and people used to say, this is great, but I'm upset. And I'm like, well, why? Because no, I didn't know about it sooner. And we don't want that to happen. We want people to know so that they can take advantage. So that one, again, it's kind of like what I mentioned earlier, finding that one person who's gonna go to bat for you is really key. And I think we got lucky. I don't know why. He just was a patient-centered IT guy, and those are probably hard to come by, but we found him, or he found us, and we just didn't give up. I mean, there's no reason to give up. Just keep fighting, don't let it go, keep it on your to-do list, follow up, follow up, follow up. Both Jackie and I are like a dog with a bone. You know, don't let it go. It's your priority, you know, keep fighting.
Great. Let's see. Um, okay. Do we have other, oh, Catherine?
Hi there again. I just
Hi.
want to let people know that I co-chair or co-facilitate our Family Resource Center networking group. It's mostly children's hospitals, but it's across the country. And we meet monthly, the second Monday of the month, 2 o'clock to 3 o'clock Central. It's virtual on Teams. And if anyone's interested in sharing more, there's so much to share. We share best practices, learn what each other is doing across the country at particularly children's hospitals. And we also have a listserv through the NNLM where we can chat with each other too. So if anyone's interested, I'll put my email in
Yes,
the
please
chat
do.
because it's a great way to connect with others.
Okay, thank you. I think that's a great idea. I like the idea of having a network for patient family resource centers. Okay,
I
well,
had one thing I wanted to mention, Marie, that
yeah.
there was a thing, a note in here earlier about what kind of statistics we collect for
Mhm.
our orientation, and I don't know if you want to address that. We count them, but I don't know that we do much of anything else.
We keep track of attendance of all the visitors at each of our centers. We keep track of the attendance at Meet the Experts and orientation, whether they're patients or caregivers. We keep track of views on the new podcast, and also the number of emails that are opened for partners, just to kind of be aware of trends and see what direction we're headed and help inform us moving forward.
Okay, well, that's a nice way to kind of end the discussion. I'm so glad that people were able to participate. That's really wonderful. We're just kind of getting close to the end. So Matt, if you can pull up the slides. So we've discussed several resources today, and I encourage you to take a look at these health systems. We have 2 slides with different health systems for more information about patient and family resource centers. If you talked or chatted in about a resource and are willing to share with others, please do so. And we're really appreciative that some of you did that already. And next slide, Matt. Okay, so this is the other slide about people with our health systems with wonderful patient and family resource centers. Okay, next slide. So Anne and Judy talked about a number of wonderful programs that they do. And so these are on the slides, but we just want to make sure that you can access them. We'll be sending out the slides after this, probably early next week, with the chat log and the recording. Next slide, please. So many of you are members of our free online learning community, PFCC Connect. If you're not a member yet, we really encourage you to register so you can access great information and resources about patient and family-centered care, post questions, learn from others, share great ideas and resources, and also continue these conversations that we're having in the informal conversations. Next slide, please. So your feedback is really, really important to us because it gives us ideas to improve our conversations and also think about future topics that we are having. You can use this link, and Sherry just chatted in the link. And then you can also use the QR code. Me, I'm not a big QR code person, but I like the links. So you do what makes sense to you. And then next slide, Matt. So our next informal conversation will be held in April 2025, and the date will be, it's still to be determined, but the topic's going to be, it's going to focus on shared access through open notes. The recording, slides, and chat will be posted on our PFCC Connect site probably early next week. And then if you have other resources that you think might be helpful to this conversation, please share it with others. You can also send those directly to me. And then, as I said before, continue the discussion in PFCC Connect. And with that, I'll say thank you all for taking the time to be with us today, and thank you for your interaction.